Well, good afternoon, everyone. Good afternoon. It is a beautiful afternoon here in Chicagoland. My name is Joteka Edie, and welcome to Time Is Now. Let's End HIV in Our Communities. This is a on-the-record press briefing and conversation. My name is Joteka Edie. I am the founder of Full Circle Strategies, and some of you may know me from Win with Black Women. As a part of my partnership with Gilead Sciences, I will be moderating today's briefing and conversation, which we are pleased to bring to you during the 2025 National Medical Association's Annual Convention and Scientific Assembly. We are called here today for an exclusive and on-the-record conversation centered on HIV prevention, treatment, sexual health, and equity. Thanks to Dr. Roger Mitchell Jr., the 126th and current president of the National Medical Association, this morning he confirmed the importance of the intersection between media, the medical community, industry, and cultural influencers that are joined in partnership today to end HIV and this epidemic in our nation. Dr. Mitchell offered a call to action to the National Medical Association as the trusted voice and conscience of the medical community, and his commitment of making HIV as one of the core pillars of his platform. Today is just the beginning. I want to acknowledge the importance of community because we have many community members in the audience today. And I want to acknowledge members of critical civil rights organizations that are joining us today in the audience, including several branches of the NAACP, several sections of the National Council on Negro Women, the National Black Justice Coalition, Win with Black Women, and members of the Divine Nine and Delta Sigma Theta Sorority Incorporated. Ladies and gentlemen, while we know that HIV can impact people irrespective of their race, their ethnicity, historically marginalized communities, groups who have experienced this have a greater burden of HIV than others, particularly Black and Latino communities. I am personally passionate about this as a Black woman who stands and lives for Black women every day. I can tell you what it felt like sitting at a Raheem DeVaughn concert and hearing through his partnership with Gilead Sciences the troubling statistic that Black women make up nearly 50% of the new HIV/AIDS diagnosis amongst women in this country. And can you imagine, as someone who had gathered nearly 100,000 Black women on a Zoom, to not know this information? I felt that it was critical that we have this conversation more in our country than ever. This event is designed to uplift voices, increase awareness, and share updates about PrEP, a proven prevention available since 2012, and an option that remains underutilized amongst the Black community, and especially Black women. We'll hear today from leaders in health equity, policy, and advocacy, alongside trusted voices, including the Grammy Award-winning artist and advocate Raheem DeVaughn, individuals living and working with the HIV epidemic, and Gilead Science experts. Each one will share an important perspective on how we can end the HIV epidemic in Black communities. We'll have time at the end of this discussion for photographs in front of the step and repeat, and we look forward to continuing the conversation with each and every one of you. It is now my pleasure to introduce Deborah Wafer with Gilead Sciences.
Oh, okay. Well, good afternoon, everyone. It's so nice to see everyone here, so many different people from so many different places. As Joteka said, my name is Deborah Wafer. I'm with Gilead Sciences, where I lead our community engagement and advocacy for U.S. public affairs. At Gilead Sciences, some of you may not know, is a biopharmaceutical company. We're located in the West Coast, in the San Francisco area. And we are a company that's about 35 years old, and we've been pursuing innovative treatment and prevention for HIV, viral hepatitis, and cancer. And these are all disease states that the numbers for Black people are high. And anyone who's worked in healthcare know how so many of these illnesses disproportionately affect Black people. And I got into this area of doing HIV care while I was working at UCLA Medical Center as a nurse practitioner and a physician's assistant. And while I was there, I had the opportunity of participating in clinical trials looking at how to prevent transmission from mother to baby. And during those days, we were able to know and test or research our way to understanding that if you treated the mother for HIV, you were able to suppress the virus. There was no virus to transmit to the baby. And that changed how women were screened for HIV. And I used to always say, one of the things you know about women who are pregnant, they had sex without a condom, right? So if they're pregnant, you should be screening them for HIV. And that clinical trial changed the way clinicians screened women. And it became part of the medical protocol that if you have a pregnant woman, you need to screen her for HIV early in her pregnancy, and then you do it again late in her pregnancy. That was one of the first things that we learned about HIV prevention. And so now we're at a new place because we now know that transmission from mother to baby hardly ever happens anymore as long as that mother is screened. And so now we have new prevention tools for HIV as well. We know that if you treat someone who has HIV, their virus goes down, there's not enough virus to transmit to another person. So we call that undetectable is untransmittable. And I think sometimes we use these terms and we don't explain them enough, but I hope everybody got that, right? That if you don't have enough virus in your bloodstream, there's no virus to transmit to another person. And so that's one prevention modality. But also, people who have HIV, if they're taking medication, they live a lot longer. People are living into their 80s now who may have been diagnosed back in the 80s. And so we know that people can live a long life if they are treated early. And now we have new prevention tools, and we know that if people are taking medication for prevention, it can prevent transmission of the virus if they have sex with someone who might have HIV. So we are excited to be here today to talk about this because I think in the Black community, we don't talk enough about this particular preventable disease. And we don't talk enough about how Black women are impacted. When you look at the numbers of people who are acquiring HIV these days, and you look at women, 50% of the women who have HIV are Black. And that is something that we want to try to get the message out about, that Black women need to be screened, need to understand that HIV can be prevented. And we're at the NMA, so we want doctors to know this too, right? That this is something that if your patient comes and talks to you about, that you talk to them about it. So we're happy to be here at the NMA. We want to partner with the clinicians who come to the NMA and anybody else out there who is interested in stopping HIV in the Black community. And we need more people like Raheem DeVaughn and folks who are part of our culture, who are trusted voices, to speak up about HIV, because together we can ensure that we can do something about this epidemic.
Well, thank you, Deborah. Yes. And thank you so much for your perspectives on how we can end HIV epidemic in Black communities. It's now my pleasure to introduce Dr. Keith Green, the Executive Director of the Chicago Black Gay Men's Caucus, a grassroots community group organization focused on advancing health equity among Black gay men, bisexual, and same-gender-loving men. He is a native Chicagoan with an extensive history as an organizer, educator, researcher, and advocate. He is also an award-winning spoken word artist. Please join me in welcoming Dr. Green.
Thank you. Thank you so much. It is indeed an honor to be here with you this afternoon. I love it when what's said before you changes the course and context of what you feel like you need to say, not want to say, but need to say. So I'm going to stay on course, but there's a couple of things I'm going to throw in there. So as someone who has been living with HIV since 1994, I know, right? You're like, that dude wasn't born then. I was 17 years old in 1994. Coming into my own, exploring, experimenting as 17-year-olds do, right? And oftentimes we put blame and shame on folks for the things that we all do. We all, if none of us experimented with sex, none of us would be here. So let's stop that. I felt like I needed to say that. But as someone living with HIV and having been diagnosed so young, it has been my passion to ensure that other young people experimenting and doing what young people do have the tools that they need, the resources that they need to live their healthiest, best sex lives. Right, and you're right, we don't talk enough about sex in our communities, and so that piece is important. In 2008, I served as project director for Project Prepare, which was actually one of the first, if not the first, study here at Stroger Hospital and Howard Brown Health to explore acceptability and feasibility of PrEP amongst young, specifically Black, gay, and Latinx men here in the city of Chicago. And acceptability and feasibility is important because we have to understand whether or not people are actually going to go for what it is that you're putting before them, right? This is an innovative technology. Are people who it would best benefit to take it up, are they willing to do so, right? So one of the first studies, then I was Director of Federal Affairs for the AIDS Foundation of Chicago because I understood that access was going to be key. We can come up with all the tools in the world, but if people don't have access to them, and we see what's happening to access right now in our country, we see the attacks on access. That's going to impact us. That's going to impact the rates of HIV, right? And so that was a critical part. PrEP was approved, as we know. I'm trying to stay back on my notes. I told you, you got me. You got me. But the truth of the matter is, medical providers are key to getting and maintaining and sustaining access, right? No matter what happens, being knowledgeable about various programs that folks can engage in to access medications and healthcare that may or may not be traditional is important. It's important that that providers are trained in cultural competency. And competency is one thing, but cultural humility and respect for other cultures is also critically important. It's also important that the message or the focus on people who are living with HIV does not get lost in the conversations that we have about prevention. Right? I love, Deb, that you said that prevention isn't just about treatment as prevention. People who take treatment live longer. Right? We're talking about people's lives. My life matters too, as someone who's living with HIV. So I think it's important that we keep the conversation multidimensional, focus on the whole of our community, reduce blame and stigma, because those are the things that are keeping us from getting to zero, and educate as much as we can about these new technologies that will help us to get there. Thank you.
Wow, powerful comments, Dr. Green. Thank you so much for your work. I think what you said about tackling stigma is such an important conversation and something that we need to have more of a conversation. It's now my pleasure to invite another Chicagoan to this, by the way of the South, to this important conversation. Please join me in welcoming Dr. Toyin Nwafor to the conversation. She is the Executive Director with Gilead's U.S. HIV Medical Affairs team, an infectious disease physician by training. She is an advocate for people living with HIV with a deep commitment to ending the HIV epidemic for everyone, everywhere.
Great. All right. Good afternoon, everyone, and thank you for having me. I am thrilled to be part of this panel, and again, just like you said, building on earlier conversations and just the conversations, especially because Keith and I go back now, Dr. Green and I go back almost probably 20 years now or more, and really lived and practiced in Chicago for, over 20 years. But my name is Toyin Nwafo. I do work for Gilead Sciences as an executive director, and Deborah had already laid out what we do and the innovative commitment to breakthrough medications in HIV, hepatitis, and cancer. So I'm proud to be part of a company that's dedicated to the innovation, but also understands the important critical need for partnerships to make sure that innovation does not worsen or deepen any existing disparities. So really looking at everything we do from a lens of equity and closing existing gaps. So we know that I've been a physician a little over 30 years now, and in HIV specifically for about 25 years. And what is very clear is, regardless of the places where I've practiced, I worked at Cook County Health, a large public hospital, for 20 years, and we at the Core Center, the largest single HIV clinic in the Midwest at the time. And I also worked at the VA hospital, I worked at the University Hospital, I worked at an academic private hospital. But what was clear was that regardless of the patient population, regardless of the payer mix or how people were accessing, there were lots of overlapping conditions and also special situations where it was very clear that we needed to adapt and look at conditions and look at patient-specific solutions, people-centered solutions to actually get things moving. In my field as an infectious disease person, it's easy enough to sit in the clinic or in the hospital or do your research, which I did, but it was also very clear that we needed to be out in the community. And it was during those community engagements that I got to work with ASOs and CBOs and the departments of public health, and got to be part of a really, I think, exciting initiative that was the Getting to Zero Illinois. We were on that together, which in 2019, and here we are in Chicago, so I got to give Illinois props. This is where we are. Getting to Zero Illinois was launched in 2019, and it was our 5-year plan at the time to get into zero in Illinois by 2030, looking at treatment, prevention, but also looking at partnerships inside and outside of the health system, looking at people in media, in community advocacy, in housing as medicine, is food as medicine, in figuring out what is the message, who are the trusted messengers in the community, because that's as important as the message, is who's giving it, and how are we getting insights and listening and focus groups to understand what the community needs, what they're hearing, is reality and perception the same, and how do we test and correct and make sure that we're getting information to people in the right way. Because regardless of what we know about how we can end the epidemic, we have the tools. We have the tools to end HIV, and I love, even in the Getting to Zero, it's very clear that we do not discount the lived experiences of the people living with HIV who got us here. There is sometimes when people say getting to zero, let's end HIV, there are millions of people living with HIV who are living and thriving with HIV, and their stories and their advocacy and their resilience and their ability to participate in trials and challenge systems is what got us to where we are. And so that has to be part of every conversation about ending the epidemic, preventing new infections, and having quality of life initiatives for people living and thriving with HIV. So that's really important, that we think about all of our programs in a status neutral way for treatment, for prevention, across that care continuum. So while we have the tools to end HIV, we have innovative prevention options approved since 2012. It was summer of 2012. We were all excited. It was July of 2012 when the first oral medication for PrEP got approved. I remember how excited I was personally about what that meant. And since then, we have new medications approved, more choices for people, but access. People have to know that these medications exist, how to get them, how to safely use them. And our healthcare providers are critical, trusted partners in having that conversation. And not just infectious disease providers, not just the HIV providers. We need to do this. And I love how the NMA this year has a lot of HIV sessions in different settings, for family medicine, for emergency medicine, for OBGYN, because it all takes all of us to have these conversations. While we have the tools to end the epidemic, in 2023, there were still 39,000 new HIV diagnoses in the US. While we have the tools to end the epidemic. And while Black individuals in the US make up anywhere from 13 to 14% of the population, they represent about 38 to 40% of people living with HIV and also new diagnoses. So there is a call to action that needs to happen. While we've had PrEP, or pre-exposure prophylaxis, for 13 years and now have many options, we still see that for all the PrEP users, less than 15% of them are Black individuals. And for women, it's less than 10%. So really, there is work that needs to be done to make sure that our innovation does not widen disparities, that we have the message and the messengers, that we're present in communities, and we're educating HCPs. And so while we're here in this conference talking to healthcare providers, it's important that when the community is getting the message from their trusted partners in the community, they do not enter health systems that stop that conversation. Healthcare providers need to be there to partner with, to dispel disinformation, to provide accurate information, and help people make informed decisions about how to protect themselves and how to live their best lives. And yes, sexual health is important, and we need to normalize those conversations in every setting so that people can make the decisions that help them live their best lives. So, thank you.
Thank you, Dr. Nawarfar. And particularly important, the conversation about the importance of the health professional in the conversation and the work to end the HIV epidemic, particularly in Black communities. Well, I am pleased to introduce our next guest. Raheem DeVaughn is a Grammy-winning R&B artist, host of WHUR's original Quiet Storm, a member of the Hip Hop Public Health Council, and longtime community activist. He is also a spokesperson for Gilead Sciences. Whether on the mic or in the movement, he is committed to elevating love, wellness, and truth. And he's here today as a proud advocate for HIV prevention. Please join me and give a warm welcome to Mr. Raheem DeVaughn.
Thank you for such a warm introduction and the opportunity to create awareness for HIV prevention. I'm no stranger to Chicago, Illinois. I've been doing community work in Chicago since 2012 when I first established my foundation, the Love Life Foundation, ranging from domestic violence as well as HIV awareness and other initiatives that we support with the foundation. I've been working with Gilead since last year, which has been an honor. We touched over 40,000 Black women in less than 30 days, touring, doing what I call, edutainment, which is a collaboration of, educating and also entertaining, talking about PrEP and prevention, which has been a very important thing, over the last 10 years having PrEP available. I've been on PrEP for the last few years. Shout out to my doctor, Dr. Hodges, who introduced me to PrEP. Finding a primary care doctor is very important. For me, I was on a search for a new doctor, somebody that I could relate to, talk to, and before we could even get into the blood work, we were talking about, PrEP and HIV and the statistics, and I'm very passionate about the work. Obviously, as an artist. For some that don't know the statistics, 100 Americans die from HIV-related illnesses weekly, and over more than 700 are newly diagnosed. We just talked about the fact that, Black women make up for, 12 to 13% here in the U.S., but more than 50% of the cases. I'm going to continue to do the work. I hope that I aspire to inspire other artists and community activists and public figures to do the work. But everybody in this room plays a vital role and sharing the message to help, end the epidemic of HIV in the Black communities.
Well, thank you so much, Mr. DeVaughn. And as we close out, I do want to invite each of you. There was an earlier conversation that we had, and the question was raised, what is your hope for the future? And what is your hope, or what is giving you hope? And I'll start with you, Deborah.
I think as a Black woman, being a clinician, my hope for the future is that people and medical providers talk to their patients to understand what their status is. Because everybody has a status, and so you need to know what it is. So just like we screen for blood pressure, you know what high blood pressure is, and you know what normal blood pressure is. I think that my hope for the future is that HIV status becomes the same way, that it becomes part of a routine workup for people, and your clinician and providers know what their status is, and no matter what their status is, there is something that can be done. I just want to say one more thing. I think one of the other things is that I don't know why, but I know why, but we're not here for that. We know when it comes to all of these health issues, Black people are always at the top of them. And I think with HIV, this is something we can do something about. And that's why I'm engaged in this work. That everybody in this room is here because somebody had sex. And for us to not be able to talk about that with our clinicians and not understand what that means, I think that's something that I would like to see us normalize and to get to in our communities, because it's no reason that people don't know their status other than either their provider's not bringing it up or they're not bringing it up. So it's on the people and it's on the providers to understand what your status is.
Very important. Thank you for that. Dr. Green.
Yeah, so my hope is that we look at the dismantling of these systems that we have come to rely on but have never really worked for us as an opportunity.
Okay.
Powerful words. I'm feeling some Audre Lorde. I'm feeling some Audre Lorde in there too, because we do know that powerful quote and her amazing work on intersectionality of all of these issues that impact us.
Yeah,
Dr.
and,
Nawarfar.
Keith just dropped the mic, literally. So, what I hope in the future is that we eliminate the stigma that comes around talking about HIV, talking about sexual health, because sexual health is health. A lot of times in the healthcare team, we have a standard, talk about physical health, mental health, preventive stuff, and then skip over to the physical exam. Sexual health is health. And so I hope we get to a space where that is part of a normal conversation within the healthcare setting, regardless of where that is, in our homes, in our communities, that we empower people to get tested, we talk about it, and we all have a status, and we've talked about this, everyone's HIV possible, and our status is not static, right? We're living, breathing human beings, and status is not static. So really being empowered that sexual health is part of your overall health, and with that comes the opportunity to know about how to protect and prevent HIV as part of just something in your toolbox to be able to have the best the sexual health that you want. And that our innovation, again, does not widen disparities, because we engage in partnerships that let those tools be accessible to the people who need them, and that we really partner to make sure that that happens. So that's my hope. We have the tools to end the epidemic. We can end the epidemic for everyone, everywhere. And because of the disproportionate impact for Black people, we really do need to be part of the solution to do this, and I know that we can.
Powerful words. Mr. DeVaughn.
I would say normalizing simply going to the doctor and getting physicals and knowing what's going on with your body. When I first heard about the statistics and how Black women were being disproportionately affected, the first thing I thought about was Black men and being a Black man. I would say, for those who maybe are in between doctors right now, or you just hell bent on not going to the doctor, they have home testing kits now. You can, you swab me, I can swab you. Yeah, real talk. No, you swab me, I swab you. We know what's going on. Again, it's just it's about the normalization of it. I would love to see us working closer, hopefully with the faith leaders in the community. You know what I mean? A lot of times I believe in the power of prayer. I said it earlier. I know we all do believe in the power of prayer, and prayer changes things. But prayer without action is blasphemy, and you have to actually go do the work, and have those. This conversation should be being had and held everywhere. Assembling for the HBCUs and colleges and universities across the country. I consider myself a young OG now at my age, right? There was a time where being young, we felt like we lived for. When you're young, you feel invincible, and you feel like you'll live forever. HIV is not an LGBTQ issue. It's not a heterosexual issue. Anybody can be diagnosed with HIV. So. Again, these, let's normalize the conversations about, sexual health and, and just advocate for that in the community. And prevention, Prevention is important as well.
Absolutely.
Being proactive.
Thank you. Powerful words. Might be some new music loading. I want to leave you all with some very important and sobering stats. In 2022, Black people represented 38% of new HIV diagnoses, despite making up only 14% of the US population. The highest rate of new HIV diagnosis among men and women of all races and ethnicities in 2022. The disparity is very clear in HIV prevalence as well. In 2022, 39% of all people living with HIV in the US were Black. Yes. Amongst Black women, 91% of new HIV infections were attributed to heterosexual contact. I'm going to say that again. Amongst Black women, 91% of new HIV infections were attributed to heterosexual contact. The HIV infection rate amongst Black women was the highest compared to women of all other races and ethnicities. PrEP is when people at risk for HIV take or receive HIV medicine regularly to lower their chances of getting infected with HIV. In 2023, Black people made up only 14% of PrEP users, despite accounting for 39% of new HIV diagnoses. Black women are also underserved by prevention methods, such as PrEP, relative to their need. Amongst all PrEP users in the US, in 2023, 92% were male, and only 8% were female, despite the fact that women comprise 19% of new HIV diagnoses. These disparities in PrEP use mirror broader HIV-related health trends in Black communities. Across multiple metrics, whether it's prevalence, new diagnosis, PrEP equity, and social determinants of health, there is a clear and evident pattern of poor health outcomes in Black communities. And while these disparities are being addressed, there is still much more to be done. I want to thank the members of the press and members of the community that are live streaming and that are covering this important conversation today. And to the media that is here today, we are asking that you let your readers and your viewers know that the first steps in ending HIV is knowing your status. If you test positive, as we've heard today, there are effective medicines that will help people to live with HIV longer and have much healthier lives. If you test negative, you have options to help prevent ongoing and acquiring HIV, including PrEP. And according to the CDC, PrEP should be prescribed to anyone who asks for it. Our call to action lives in amplifying this message, everyone. The message that HIV, this epidemic, is not over. Yes, we have made great strides and we've heard such great conversation around all of the advances, but there is still much that needs to be done to end HIV in our community. We must call on trusted voices like those that have spoken today, as well as those of the National Medical Association membership, to normalize and routinize HIV doctor-to-patient discussions. And with your help, we can and will end HIV in Black communities. Thank you so much, and this concludes our conversation for today. Let's please give all of our distinguished guests a round of applause for not only their work, their presence, and their advocacy. I would like to thank the team at Gilead Sciences and all that have worked so hard to bring this together. I will now invite our distinguished guests and panelists to join us at the step and repeat for photos, and members of the press. We do invite you, if you're taking still photos or video footage, you can capture B-roll there as well. Thank you all very much.